Body fluids. Phagocytic activity. Monocyte, neutrophils, macrophages. Not phagocytic. Basophil. Dengue fever. Significant decrease in platelet count. Cardiac cycle. Volume of blood pump out by right and left ventricular is same. Coagulation. K plus Ca plus ion and platelet factors. Not ECG. Repolarization of arteria. Lack nucleus, no DNA in RBC. Antibody production, B lymphocyte. Cardiac impulse, SA node and AV node. AV bundle Purkinje fiber. Second heart sound, dub closure of semilunar valve. A granulocyte responsible for lymphocytes. QRS complex, ventricular contraction. 72 heartbeat per minute, stroke volume of 50 ml, 3600 ml. Lymphatic system, drain back tissue fluid to circulatory system. Pulmonary vein, carry O2 blood. Lymphocyte, immune response, 5 liter, 5000 ml per minute. Cardiac output, heart rate into stroke volume. Heart rate, cardiac output divided by stroke volume. Stroke volume equals to diastole minus systoles. Sympathetic system stimulates rate and stroke volume. P waves increases repolarize arteria. QR complex depolarizes ventricle. T waves repolarizes ventricle. Reduction in T waves is since depolarize arteria. Antibodies and defense mechanism. Serum globulin. Lymph increases WBC and no RBC. Articulates thick walled and narrow lumen has two veins. Injection on arteries. 100 ml blood, 12 to 16 hemoglobin. RBC human 20 to 25% of CO2. Injury chordae tendae tricapsid to together dissolve in systolic blood pressure. P wave constriction of both atria. Parasympathetic heart reduce both heart rate and cardiac output. Blood pressure in mammalian aorta maximum. Systole of left ventricle. Erythropoiesis start in red bone marrow. Blood plasma plus RBC plus WBC plus platelets. Second heart sound, semilunar valve closed down after blood flows into vesicles from ventricles. Largest amount of urea, hepatic veins. Blood to the liver from intestine. Blood pressure pulmonary artery increases more than that in pulmonary vein. A reduction in the pH of blood decreases the affinity of hemoglobin to O2. Serum, lack of clotting factor. Tricapsid valve between right and left, right atrium and right ventricle. Bicapsid valve between left atrium and left ventricle. Semilunar valve between right ventricle and pulmonary artery. Inactive fibrinogen enzyme thrombin, fibrins. Eosinophils release histamines, destructive enzymes. Basophil release granules containing histamines. Neutrophils, phagocytosis. Lymphocytes, immune response. PNS decreases in cardiac output. One atria, one ventricle, fish. Gills or O2 blood. Thickness of chamber, injury, myocardial. Second auricle from ventricle of these sides or arterioventricular septum. Chordae tendae, ventricles. Cardiovascular medulla oblongata. Arterial systoles, VS, joint diastole, repulsive LC. 0.8 Hz cycle, VS 0.3 cycle. Intervals 0.5 seconds. Walls artery differ walls of arterioles, tunica adventitia. Heart से lungs से heart is pulmonary cycles. Portal system, veins start from an organ and ends up in another organ. Crocodile, 2 auricle, 2 ventricle. Myogenic heart, frog, rabbit. First heart sound, love sound produced at beginning of a systole. Impulse, SA node, AV bundles, Purkinje fibers, heart muscles. Erythroblast fetalis, fetus would be suffered by severe anemia and jaundice. Lactose are the lymph capillaries, neck region. Right ventricle, pulmonary artery, CO2 blood, lungs, pulmonary veins, O2 blood, left. Cardiac musculature, coronary circulation. Papillary muscles, ventricle walls. Pectinate muscle, arterial wall. Semineural valve, tricuspid valve. Endothelium, endocardium. Right caudate ende cut down, deoxygenated blood start back flow in heart. Cardiac arrest, heart stop beating. Heart failure, heart is not pumping blood effectively. Heart attack, heart muscles are suddenly damaged. Angina pectoris, cut, chest pain. Right blood pressure affects heart, kidney, brain. High blood pressure है. Artificial pacemaker implants irregular in heart right है. PNS decreases heartbeat rate, decreases speed of conduction of action potential, decreases in cardiac output, decreases heartbeat rate, decreases cardiac output, acetylcholine. Open circulatory system, SKDSA, cockroach, a small squid. Reproductive reproduction of repolarization of artery is not present. Eosinophils resist infection. Blood lose maximum O2, pass through tissue capillary. Veins has thinner walls, large lumen, less musculature. Greater portion of circulatory present, large veins. Right ventricle, PA, lungs equals to PV. अरे वो आ रही है. PV, pulmonary artery, lungs, pulmonary veins, lung, left atria. QRS complex in ECG, ventricular constriction and arterial relaxation. Erythrocytes, blood cells that counts hemoglobin and transport O2. Eosinophils resist infection and allergic reaction. Monocytes, specialized antibody produced with blood cells. Neutrophils, most abundant WBC and main phagocytic cells of blood. Basophils, least abundant WBC. Blood clotting, calcium plus thromboplastin. Total number of veins in a heart. Heart valves, artery and veins. Systematic heart compromises left atria and left ventricle. RWC marks beginning of systole. Vitamin K, formation of prothrombin. Leukocyte in human body, neutrophil, lymphocyte, monocyte, eosiophil, basophil. Cardiac cycle, joint diastole, arterial systole, ventricular systole, autonomous neural system, sympathetic system, stimulate heart rate and stroke volume. RA in lungs, tricuspid valve, right valves, right ventricle, SV, pulmonary artery. 90 to 90% plasma membrane, water. Plasma is water. Tricuspid injured, blood into pulmonary artery will reduce. Tricuspid, bicuspid present, back and flow into atria. O2 blood pump into aorta. DO2 blood pumped into pulmonary artery. Impulse heart, SA node, AV node, bundle of His, Purkinje fiber. Neutrophils 60 to 65% of WBC. Eosinophils 2 to 3% of WBC. Formal element 45% of blood. Increase in ventricular pressure causes closure of tricuspid bicuspid valve. Monocyte, agranulocyte. Leukocyte, short-lived. Veins carry blood from all organs to heart. Veins, nodal musculature, generate action potential without any external stimuli. Ventricular septum thicken, then inner articular septum. Pulmonary artery receive deoxygenated blood from right ventricle. Kidney shape muscles are high motile and phagocytic monocyte. Heartbeat is greater than 100 times per minute, tachycardia. Artificial pacemaker works as originator of cardiac muscles. ABO blood group, called alendestrin. Hemidal cockroach, RBC gas transport, antibody immunity, platelets coagulation, systole contraction, basophils allergic, human circulatory systems, heart is tetraloticule myogenic, blood lymph circulatory fluid. Potential difference to heart muscles, electrocardiograph. Contraction element, erythropoiesis, leukopoiesis, platelets. Not constituent of blood element, plasma. Platelets also called thrombocytes. Platelets cell fragments produced from megacyte. Most abundant WBC, neutrophils. Least abundant WBC, basophils. Megakaryocytes, bone marrow. Leukocyte destroy virgin origin, neutrophils, monocytes. Eosinophils, allergic reaction. Basophils, inflammatory reaction. Neutrophils, phagocytic cell. Lymphocyte, immune response. Monocyte, phagocytic cell. Reduction in number of platelets, clotting disorder, excessive loss of blood from the body. Eosinophils 2 to 3%, basophils 0.5 to 1%, neutrophils 60 to 65%, lymphocytes 20 to 25%, monocytes 6 to 8%. Decrease in order, leukocytes, neutrophils, lymphocyte, monocyte, acidophils, basidophils. Both heparin and histamine, basophils. Cell fragments of megakaryocyte yields blood platelets. Osmotic albumin. Erythrocyte 5 to 5.5 million mm per cube. Leukocyte 6,000 to 8,000 millimeter cube per millimeter cube. Platelets 1,50,000 to 3,50,000 millimeter per cube. Anticoagulants, mast cells. Large corpuscles of mammal's blood, monocytes. RBC ratio WBC 600:1. Induced immune response, antigen. Rh positive 80%. Erythroblast fetalysis, service anemia, jaundice and fatal to fetus. Rh minus Rh antibodies, mother cell second deficiency. Second delivery. Rh factor, mon and rhesus monkey. RAB, Rh positive and man, Rh negative women. Child death due to Rh positive men, Rh negative women. Linked enzyme in reaction, thrombokinase. Vitamin K, prothrombin. Thrombokinase gives thrombin. Fibrinogen in presence of thrombin gives fibrin. Lymph, intercellular fluid to blood. Thromboplastin, coagulation of blood. Interstitial blood coagulation, prothrombin. Right and left ventricle into pulmonary artery and aorta, semilunar valve. Sinuses, opening circulation system. AV of same side, step by step, thick fibrous tissue, arterioventricular and septum. SAN, sinoatrial node, nodal tissue, right upper concentration of right atrium. AVN, left come to right atrium, top of the interventricular septum, atrioventricular bundles, AV bundle. AV divide right and left bundles. Right and left bundles rise to minute fibers, ventricles, cultures, Purkinje fiber. Maximum number of action potential generated, SAN. Joint diastole, bicuspid, tricuspid valve open, semilunar valves closed. Ventricular systoles, bicuspid and tricuspid valves are closed, semilunar valves are open. Ventricular pumped blood, stroke volume, beat volume. Body has ability to alter stroke volume, heart rate and cardiac output. Cardiac cycle, profound per minute 72. Number of beats per minute, heart rate. Fishes, single circulation. Amphibians, reptile, incomplete double circulation. Birds, mammal, double circulation. Graph representation, electrocardiogram. Machine, electrocardiograph. Heart attack, arteriosclerosis. ECG study of heart posture क्या है? Heart amount of blood pumped by heart into body per minute, cardiac output. Cardiac and output, heart rate and stroke volume. Value of cardiac output, stroke volume into rate of a heartbeat, blood pumped per minute. Figure heart, bundle of his Muscular tissue of supply ventricles. Heart of heart, SA node. Lymph only, WBC. Heartbeats originate from pacemaker. Bundle of His network of muscle fiber found only in ventricular wall. Artificial pacemaker, SA node. Impulse of SA node terminates to AV node. O2 एंड CO2, टिश्यू से O2 आ रहा है, टिश्यू में O2 आ रहा है, टिश्यू से O2 जा रहा है. सिस्टमेटिक सर्कुलेशन. हार्ट ब्लड सिंथेसिस, कोरोनरी सिस्टम. Autonomous nervous system, increase heartbeat rate, increase the strength of ventricular contraction, the cardiac output. Systematic circulation pathway, veins A in left ventricle, aorta, arterioles, tissues, veins, right atrium. Measurement of blood presence sensors, resting pressure, numerator, pumping pressure, tunica media, yellow fibers and smooth muscles. W blood pressure LV, right A. Systematic circulation, veins, thick wall, hepatic arterial 2 times. Blood pump controlled by adrenal gland. O2 blood is pumped into aorta. Deoxygenated blood, pulmonary artery. Synaptic heart, left atrium, left ventricle in high vertebrates. Diastole heart is filled, venous blood. Pulmonary circulation, right auricle, deoxygenated blood, large. Congenital blood, left auricle. Pulmonary aorta during deoxygenated blood from right ventricle. Veins carry blood from organs to what heart. Pulmonary veins, O2 blood. Supervena cava, deoxygenated blood into right atrium. Inferior vena cava brings deoxygenated blood from lower part of right atrium. Pulmonary artery carries deoxygenated blood to lungs. Pulmonary veins carries O2 blood from lungs. Systematic blood circulation states from left ventricle. Angina occurs closure of bicapsular and tricapsular valves. Synaptic gamanometer, synaptic and diastolic pressure. Butter, red meat and excretory hyperchlorhydramnion. PNS and nerves cut, heart increases. Erythropoiesis assist Fe2+. Mineral coats heart and Na+. Neurologic heart. Larvae increases the role. Middleman body, lymph. Oval RBC, camel. Colorless blood, cockroach. Devoid of muscular coat, capillary. Systole causes exist of blood from ventricle. Blood capillary, endothelium only.